Hello, this is Leslie from 1302 English, and I'm with Mary Lee for interview 2. Ready to start?
Yes.
Make sure you're clear.
Yes.
What is your experience with Alzheimer's? Like, what do you know about it? How do you know about it? You're right.
My dad had Alzheimer's. It started to increase and get worse. And I learned that there's no cure for Alzheimer's. And as the years go by, months go by, the disease increases. And they start to forget their family members. They forget the present and remember the past.
Alright. Now, on to a different kind of topic then. How do you feel Texas is on our status for medical workforce? Do you think there's a proper numbers? What do you think about the numbers of workers we have for medical workforce? Do you know anything about current pay?
The medical workers like physicians or doctors?
Anybody in the medical field. Doctors to nurses to physicians and such.
Okay, as for nurses, we have a lot of need for nurses. We do have a lot employed, and I feel that the workforce right now, their hours have increased, yet the pay needs to increase. The pay is not as high as it should be. As for physicians, we need a lot of physicians, a lot of specialists in the Rio Grande Valley or in Texas.
Okay. What do you know about the current treatment for Alzheimer's? Do you know how treatment works? Do you have an idea what patients go through?
The only thing that I know about treatment for Alzheimer's is that they developed a pill that is supposed to stall the Alzheimer's, but it is just a test. They still need to do a lot of more experimental and scientific part of it, so it's just something they're trying. It's like a trial basis. I honestly don't know if it's really working.
Okay. Now, let's see. What is your stance on the idea of maybe the government providing direct funding for advancements in medical care for residents of Texas?
The government providing funding?
Mm-hmm.
If they would concentrate in providing more funding for the medical workforce, that would help a lot. Right now there's a big need in funding, so we don't have all the assistance that here the people in the valley or in Texas need. So I think if the government would concentrate a little bit more in funding their own people in the medical workforce, things would be a lot better for the people.
Okay. As a citizen, how informed do you feel your fellow Texans are on current medical issues? Oh wait, sorry. How do you feel? As a citizen, how informed do you feel fellow Texans are on Alzheimer's? Have you ever heard any discussions in passing of of dementia and such diseases?
For the diseases, and I'm informed due to the information that I got for my father. As far as the people, we need more information. We need more, continuing education and funding to maybe more conferences referring to dementia or Alzheimer's. There's some, but not all people are able to go. I think that the families of those who have those diagnoses and that cannot afford to go to a place should have some kind of funding for them.
Okay. Now, as the last question, if the average Texan had a constant news flood of current medical issues, of advancements, do you think the state government would manage their funding differently? And possibly why?
Because there was more.
If the average Texan had a consistent news on current medical issues and advancements, Do you think the Texas state government would manage its funding differently?
It would, because the people would be more aware of the diagnosis, more aware of what to do to prevent it, if it can be prevented, or more aware and more testing would be provided, because the people would be more on top on the government. The people would be fighting more for their rights, referring to fundings in the medical field, in the medical diagnosis for the regular people that are not educated would be more educated.
Okay. Thank you very much.